Let's talk about dysmenorrhea. Dysmenorrhea is a medical term used to describe painful menstrual cramps in the lower abdomen or pelvis that occurs before or during menstruation. It's a common gynecological condition that can significantly affect a woman's quality of life. Dysmenorrhea can be primary, meaning it occurs without an underlying medical condition, or secondary, where it is caused by an underlying condition. Primary dysmenorrhea is a type of dysmenorrhea not associated with any underlying medical condition. It usually begins a few years after menarche and improves with age or after childbirth. While secondary dysmenorrhea is caused by an underlying medical condition such as endometriosis, uterine fibroids, adenomyosis, or pelvic inflammatory diseases. It can develop at any age and tends to worsen over time. The causes and risk factors for dysmenorrhea vary depending on the type. The exact cause of primary dysmenorrhea is not fully understood. It is believed to be related to increased production of prostaglandins, which are hormone-like substances that play a role in uterine contractions and inflammation. Secondary dysmenorrhea is often caused by underlying conditions which affects the reproductive organs, such as endometriosis, adenomyosis, uterine fibroids, pelvic inflammatory disease, or ovarian cysts. Risk factors for dysmenorrhea include early age at menarche, heavy or irregular menstrual bleeding, smoking, family history of dysmenorrhea, and a personal history of pelvic inflammatory disease or sexually transmitted infections. The main symptom of dysmenorrhea is pelvic cramp or pains that occur before or during menstruation. Other symptoms may include lower back pains, nausea or vomiting, diarrhea or constipation, headaches or migraine, fatigue or dizziness, irritability or mood changes. The severity of symptoms can vary from mild to severe and may interfere with daily activities and quality of life. To make a diagnosis of dysmenorrhea involves a combination of medical history, physical examination, and blood investigations, and also ultrasound scanning. The healthcare provider will inquire about the nature and severity of symptoms, menstrual history, and any relevant medical condition. A pelvic examination may be performed to assess the reproductive organs for any abnormalities or signs of underlying conditions. In some cases, imaging tests such as ultrasound scans, magnetic resonance imaging, or computed tomography (CT scans) may be recommended to evaluate the pelvic organs and to rule out structural abnormalities or underlying conditions. In certain cases also, a minimally invasive surgical procedure called laparoscopy may be performed to visualize the pelvic organs and diagnose conditions such as endometriosis or adenomyosis. The management and treatment of dysmenorrhea depends on the severity of symptoms, underlying causes, and the individual's preferences. Over-the-counter non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen are often prescribed or recommended to relieve pain and to reduce inflammation. Hormonal contraceptives such as the combined oral contraceptives, the progestin-only pills, hormonal patches, or hormonal intrauterine devices can help regulate the menstrual cycle, reduce the severity of menstrual cramps, and alleviate symptoms. In cases where dysmenorrhea is caused by an underlying condition that does not respond to conservative treatments, surgical interventions might be considered. For example, laparoscopic surgery can be performed to remove endometriotic implants or fibroids, or to treat other causes of secondary dysmenorrhea. Some women find relief from dysmenorrhea symptoms through alternative therapies such as acupuncture, acupressure, dietary remedies, or dietary changes. However, evidence supporting the effectiveness of these approaches is limited, and it's important to consult with a healthcare professional before trying any or alternative treatments. In addition to medical treatments, certain lifestyle measures and home remedies can help manage dysmenorrhea symptoms. Placing a heating pad or hot water bottle on the lower abdomen or taking a warm bath can help relax the muscles and alleviate pain. Engaging in regular physical activity such as walking, swimming or yoga can help reduce menstrual pain and improve overall well-being. Practicing stress management techniques such as deep breathing, exercises, meditation or relaxation techniques can help alleviate pain and promote relaxation. Some women find that reducing the consumption of caffeine, alcohol or salty food can help reduce symptoms of dysmenorrhea. As we conclude this segment, it's important to understand that dysmenorrhea is a common gynecological condition and is characterized by painful menstrual cramps. Hence, it's important to understand the causes, symptoms, diagnosis and management options for dysmenorrhea, as this is essential for women's health and well-being. Open communication with healthcare providers, adherence to recommended treatments, and self-care strategies can contribute to better management of symptoms and an improved quality of life.